Hello, everybody. I'm Nathan Grills. I'm a professor and public health physician at the Nossal Institute for Global Health at the University of Melbourne, and I'm a senior research advisor at the Australian India Institute. Today's session is been hosted by the Australian India Institute to try and promote a dialogue between Australia and India, particularly around issues that are affecting us in the COVID space right now. To begin by acknowledging that many of us are joining this call from traditional lands of the Aboriginal and Torres Strait Islander people. For myself, that's the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders, past, present, and future. So we know that COVID has closed the world down, and we know to open up safely, we're going to need to have widespread vaccinations. And vaccines have been at the forefront of most of our conversations for the last 6 months, which is great. We have very effective vaccines. But it's been particularly relevant in the case of India and also in Australia. Both India and Australia are behind our targets to really meet that, up to 80% would be our ideal target in Australia. And we've both India and Australia have faced issues of demand and supply. Availability is a concern for India, and India has a central role at the rollout of vaccination campaigns worldwide, given they're a big supplier and producer of vaccines. And in terms of demand, we're facing issues of vaccine concerns and vaccine hesitancy and fake news, and the other end of the spectrum around anti-vax sentiment, and an issue both in India and Australia. So what can Australia and India learn from each other's experiences, and how can we work together on such issues as this? And that's where I'm hoping that our three experts today, I know, will be able to speak into this space and help us to address these issues. So to welcome Professor Joy Mammen from Christian Medical College for Law in South India. He's the Assistant Director for CMC for Law and is heading the CMC for Law's vaccine rollout program. So welcome, Joy.
Thank you.
And to welcome Associate Professor Margie Danchin. She's a consultant paediatrician at the MCRI, the Murdoch Children's Research Institute. She's also the group lead for vaccine acceptance, uptake and policy at MCRI. And she's an immunisation expert with over 10 years of experience in vaccine research and clinical work, both in Australia and more recently in the Western Pacific region. And she's very ideally placed to be able to answer some of our questions around this area of vaccine rollout. Welcome, Margie.
Good to be here.
And just to finally welcome Dinesh Malhotra. He's a lawyer, come journalist, I think. He's a well-known commentator on Australia and India relations and has been for the last 25 years. 25 years ago, he started the Bharat Times, which is an Australian paper aimed at Australians of Indian origin. And it's one of the most widely read papers, or the most widely read paper, I think, amongst Australians of Indian origin. So welcome, Dinesh.
Thank you, Nathan. Thank you for having me.
I was going to start by just framing the discussion that we're having today. And I wanted to ask each of you about the situation that we're facing right now. And specifically, the first question is where are we up to in vaccinating India, in vaccinating Australia, and in getting vaccines rolled out across the world? Joy, could I ask you to tell us about where India is at in terms of their vaccination program?
Yeah, India started its vaccination program in January. 20th of January was when we started off the vaccination program. It was fully funded by the federal government of India, and the target population were healthcare workers. And we opened it up over phases. In phase 2, we also included non-healthcare workers, frontline workers, as well as persons over the age of 45 with comorbidities and persons of age 60 and above with or without comorbidities. It was a phase plan to identify risk groups and to target them specifically. And then in phase 3, which has had its own wrinkles, it was opened up for public and private purchase and rollout from the month of May, which has not really been particularly successful. So the policy has changed and we've gone back to 75% of the vaccines being centrally procured and rolled out through state mechanisms. And about 25% of the production is available for private purchase. There is still differential pricing in the country, and that is something that we are concerned about. However, as of yesterday evening, I think about 289 million people have been vaccinated, have received at least one dose of vaccine, of which 238 have received at least one dose, and 51 million have received 2 doses. That's about 3.8% of our total population. So the numbers look big, but when you look at the overall population, it kind of goes down to about 3.8% having received vaccination.
Margie, that's amazing to hear from India that they vaccinated, I think yesterday, 8 million people in one day, which is impressive. And, you know, it's been a challenge in Australia to get people vaccinated. Can you give us an update in Australia about where we're at in terms of people vaccinated and coverage from the vaccine?
Yeah, sure. So there's actually a lot of similarities, I think, between the Australian and the Indian rollout when you hear Joy talk about it. Our program started in late February, and we've had 2 main vaccines, the AstraZeneca vaccine and the Pfizer vaccine, since the start of the rollout. And similarly, we've had a phased introduction of the vaccine starting with the most at-risk populations first. Again, frontline healthcare workers, quarantine workers in the 1A group, and then in the 1B group, the people at risk, so over the age of 70, and those with at-risk medical conditions, and then moving down. So at this stage of the program rollout, I think we have about 20% of the people who were eligible for vaccination have received 1 dose, and it's between 4 to 5% of people that have probably received 2 doses now. The majority of the vaccine delivered has been AstraZeneca vaccine, probably 2/3 of the doses. The rollout has been very challenging, initially mainly because of supply issues. The initial batches of AstraZeneca due through the EU and Europe didn't arrive. So we've had significant constraints around supply, which has definitely hindered things. And the other issue in Australia has been this tension between the Commonwealth controlling the program rollout and then the states obviously needing to deliver the vaccines. Usually in Australia, with a new vaccine introduction, it's managed by each state. So there's been a complex interplay in Australia between what's state-owned and run and what the Commonwealth are leading, which has led to some confusion. So we've definitely been hampered by a lot of practical issues in our rollout, which I'm sure we can get to a bit later. But we also, of course, have had issues around confidence and people having concerns, particularly with the clotting issue around the AstraZeneca vaccine. But in terms of where Australia sits, I mean, I think at the moment, the UK, Canada and Israel are sort of leading the leaderboard in terms of at least 1 dose of vaccine administered, around 60 to 70%, which is so impressive. Whereas the US, Italy, Germany, France are more around 45 to 55%. And then you jump down, and I think Australia and India are sitting similarly around that 15 to 20% mark of people having received 1 dose of vaccine. So I think our rollout continues to have challenges, but it is starting to ramp up now. But as you said, you know, we would ideally like to reach around 80% coverage in the population. So we've got a very long way to go in terms of targeting people, opening up the program. At the moment, eligibility is for 40 years and over, but we have this complex situation in Australia where people between the age of 40 and 60 can have the Pfizer vaccine, and people over the age of 60 are eligible and are asked to have the AstraZeneca vaccine. And again, that comes back to the safety concerns around TTS, or thrombosis with thrombocytopenia syndrome, and that our main governing body, the ATAGI, the Australian Technical Advisory Group on Immunisation, only made that change or that recommendation last week, which was enacted by the government. So lots of challenges in the program rollout, people really asking for choice here and for the program to be expanded to younger people. But I think we're starting to get there slowly.
Thanks, Margie. Margie, you've spoken a lot about, I guess, more supply of the vaccine there. Do you want to describe some of the issues we've faced in terms of demand from the public for the vaccine?
Yeah, so I think when we think about demand, instantly everyone thinks about vaccine hesitancy. And we have definitely had people, along the spectrum who reasonably have questions and concerns about these vaccines, right the way through to people who are really anti-vaccine or actively campaigning against the vaccines. In terms of the most common concerns that people have, and I think quite reasonably, it's been around the speed of vaccine development. We know it normally takes about 10 to 15 years for a new vaccine. And of course, we've got these COVID vaccines in about 6 to 9 months. But most of the concerns centre around vaccine safety, and interestingly, not only around the more serious side effects, but also the common expected side effects and concern about any potential long-term effects. So those have been the main issues, but of course, towards the other end of more extreme hesitancy or refusal, we have had a lot of misinformation and conspiracy theories, anything from, vaccines containing microchips to the mRNA vaccines or the Pfizer vaccines potentially being inserted into people's DNA, or impacts on fertility for pregnant women. And a lot of that misinformation has been circulated quite widely. So, but as I said before, sometimes those practical issues to vaccination, or what we call access factors, have also been rolled up into hesitancy, which of course they're not hesitancy if somebody can't actually book to get a vaccine or waits a long period of time. So I think quite complex there. But what I would say around the demand side, and this is true for India and everywhere, is these issues centre around trust in government, trust in medical providers, and people really having the confidence to make a decision to have a vaccine and to come forward. So it'll be interesting to see what Joy thinks around that in India too.
Yeah, and we'll come back to that, Joy, and ask you your experience in India. I want to just bring in Dinesh now to ask him about the media's role amongst the Indian community in Australia. Experience of their engagement with vaccines and their willingness to get vaccines?
In Australia, the Indian community has been, I think, proactive. They have been participating in many discussions and forums, and their uptake of vaccination is also quite good numbers-wise. The last I heard in a forum by the VMC was that I think it was 38 to 45% people were attending vaccination centers. Yes, there is an issue of long waiting periods and people being turned away. That is, in my view, an administration issue. We have to remember one thing. Generally, no leader in anywhere in the world has got intentions of stuffing up. We are dealing with event once in a lifetime. There is no prototype to follow. So when there are issues, fake news, social media, other players coming in, the leaders are trying to do their best. Yes, I guess supply is the bigger issue, and the trust factor, I think media can kind of mend its ways to attack the social media and fake news, and then probably bring people to the vaccination centers.
Dinesh, the social media environment is a much more difficult to control form of media, I think. And I've got lots of friends in India, and I've worked there, and I'm there 5 times a year normally. And a lot of my friends have been sending via WhatsApp and Facebook a lot of misinformation around it. It's really difficult to know how to address that. And it happens in Australia as well as India, but there's a sort of cross-pollination. Do you think that in the community here, amongst the Australians of Indian origin, do they get a lot of information from social media in India as well as Australia? And how does your paper, the Bharat Times, address these issues or encourage people to go to the right sources for information?
The Indian community is quite mindful of what can be wrong, what can be right in the social media space. And all the fake news, all the attacks on Modi and the opposition and vice versa, Australian Indians I think they're quite skilled in understanding and separating the spin from the actual facts.
The paper, the Bharat Times, have you been able to comment much on vaccines or promote vaccines through your media, or how do you address that?
Yes, we have been doing stories not on a daily basis, but as and when it is appropriate. if there is kind of, when the hesitancy hit the community a little bit on the clotting side of things with the AstraZeneca vaccine, we did a couple of stories, we did the newsletters, trying to educate people that the risk is absolutely, and we should be getting vaccinated, because if you remember, the health minister, Greg Hunt, said, if you don't get vaccinated and you get COVID, you may die. So that was the message we got to the community, and I think the numbers went up. People are getting vaccinated. I myself got vaccinated, my first shot yesterday, and there was a long queue there as well. So people are going.
And Joy, you've had a personal experience of both having a vaccine and also having COVID. Do you want to tell us a bit more about that?
Yeah, actually, in CMC, we decided that as many members of the administration should take the vaccine as early as so within the first 3 days. Practically all senior administrators in the institution had got vaccine. About middle April, about 3 months after the vaccination, I did contract COVID in the middle of the second wave, and was at home for, I think, about 14 days according to our protocol. But it was a very mild episode. It was more like a severe viral fever, and the fever stopped in about 3 days, and then we were quarantined for the 10 days, and then we got out after that. So it was a very, compared to what many other people have gone through, this was a very mild experience, and we are very grateful to God for that. And I often use this as an example when speaking to our own communities and people who are reticent about taking the vaccine, that there is a beneficial effect, and as many people are offered the vaccine, should step up and take the vaccine.
Margie, I might come back to you. I mean, the Children's Hospital in Melbourne and MCRI is very well respected amongst the community. How have you at MCRI and the Children's Hospital been able to promote vaccinations amongst your staff, and then also in the wider community? And I note that a number of staff, the majority of the medical and health staff, want to get vaccinated and know the importance of it, but there is some that are still choose not to get vaccinated. So how do you as a hospital address that and model that, and then also in the community, how do you promote that?
Yeah, well, of course, the challenge with this COVID vaccination program is an adult program, and we're used to a lot of the new vaccine introductions being paediatric or for children. So it has been a big pivot for us, obviously, as a children's hospital, and I've been working very closely with the Victorian Department of Health and the Commonwealth Government around the rollout. And I'd say there are really 4 key things, both at the Children's Hospital and sort of more broadly in the community, that we've been working on to increase uptake. The first would be to really try and overcome those practical barriers that I mentioned, which have been huge in terms of making people or helping people be aware of their eligibility, how to book an appointment through a central booking system or accessing phone lines, and then how to actually get the vaccine and give them information on what to expect. So, and that's actually been a huge hurdle. Even, you know, we've been giving the Pfizer vaccine through hospital hubs, and the AstraZeneca vaccine has mainly been rolled out in general practice in primary care across the country. So it's actually been very complex depending on which group you're in and which vaccine you're getting, where you go. It just hasn't been easy, and it really has slowed things down. The second thing would be around good resources and support for providers giving the vaccines, because there have been a lot of questions and concerns, particularly around the clotting issue with AstraZeneca. So having good resources that providers can use to support those important risk-benefit discussions has been really challenging. The government has now provided financial reimbursement for counselling for GPs, for example, and for immunisers to have longer conversations to address concerns. But really supporting primary care and the providers administering the vaccines has been really critical. And then following on from what Joy was saying, I actually think almost the most important aspect is community engagement and really working with community leaders, faith leaders, Indigenous leaders, and also people in industry as well as healthcare providers. But we've been running a program with the Victorian Department of Health called the Vaccine Champions Training Program, where we've been running webinars and sessions where we've been essentially training the community and faith leaders around the program, giving them information on safety and effectiveness but also kind of empowering them to be a vaccine champion or an advocate, if you like. And then they've been going back into their own communities, and that's who the people want to hear from. They want to hear from people they trust and who they identify with within their own communities. So that program has been incredibly successful, and we're expanding it now regionally across Victoria. And we've got about 500 champions that we've trained up that have gone back into the community. And I think that's had a really big impact on confidence and being able to address concerns. And then the last strategy is probably around tailored and broad campaigns. So messaging not only around the effectiveness of vaccines for the prevention of disease, because in Australia, we've actually had very low disease rates. So people here, many people, are not worried about getting sick, or they don't feel like they're going to get sick, very different to the situation in India. So we've really had to work hard to frame the benefits of vaccination more broadly, so more around freedom from lockdown, freedom from school closures, financial security, being able to see elderly grandparents freely in aged care, or even to be able to travel domestically in Australia, and really helping people to understand more broadly why they should come forward and be vaccinated if they don't think they're going to get sick. And so I think those sort of 4 strategies have been really critical, and that's what we're working on now. And, you know, we're constantly having to update the information we're providing and the concerns we're addressing. And at the moment, there is a real crisis of confidence in our main vaccine that we have in the program, which is AstraZeneca, and really getting this delicate risk-benefit balance right for people, to encourage people over the age of 60 to come forward and be vaccinated. But personally, I think this is the best strategy that we can do is around community engagement and speaking to people and reassuring them.
Margie, that's really important. I like that, you know, the idea of the community engagement and the champions. Dinesh, come to you. Obviously, you're in the community through the Bharat Times, and you're read, you know, widely amongst the community, particularly the community of Indian origin. How do you think or have you been able to, with government and health institutions, to be able to reach into the communities and to be able to promote awareness around vaccines?
Yeah, as I said, we've been doing community forums where the information has been shared with people to remove the mistrust or the hesitancy. I'll give you my example. As I said, I got the shot yesterday. I was not hesitant, or I was not worried about the clotting issues, because I can understand it's 1.5 in a million or something risk, so there's hardly any risk. But the issue was the long waiting periods and going and queuing up at the centers, traveling to the city or a particular center. How I got the vaccine, because my local GP has now access to the vaccine, and he's been allowed to have, I think, 1 day a week, tell the community to book the vaccine for a Tuesday, and then they can go and you know, get the vaccination done. That is where the community engagement focus of the government and the administration comes in. They should have factored all these things in. Australia being a multicultural society, it's not a kind of monoculture. They release the thing on TV or media release on the radio and everyone will understand. The trust factor in the community engagement plays a big role. Now, all the local GPs, if they get access to the vaccine and their patients, various communities, multicultural communities, they trust their GP more than anything being said on television by a health minister or any other expert in a webinar. That is where we have been playing our own small role, telling the community to go and talk to their GP, and they are the best advice they can have. And the GPs are now starting to get the access to the vaccine. And I think we will get numbers going up very shortly.
At the Bharat Times, has the government engaged much with you to try and get messaging to that community across Melbourne or across Australia?
Yes, we have been advertising. We have been getting state and federal government messages that we have been sending to the community. Yes, since I think last year, from April, May onwards, we've been engaging with the community. Yes.
That's great. It's a really important role that you've played at the Bharat Times. So thank you, Dinesh, for that support. Margie, given the pressure on vaccine supply in Australia, and likewise we've heard in India, getting access to vaccine and the numbers that are required is very difficult. What role do we, though, in Australia play in helping other countries, regional or other countries that are low middle income, actually get access to vaccines when we're already facing our own shortages here?
Yeah, I think that this sort of issue around vaccine equity is absolutely critical and something that I'm very passionate about. And as we all know, the COVAX facility was established to try and have a more equitable distribution of vaccines to low and middle income countries. But in reality, we all know that's been a huge challenge, and that many of the low and middle income countries who need the vaccine the most have barely started their programs. And you only have to look at the WHO dashboard of the number of vaccines administered to see that really starkly, just how there is such a huge discrepancy. And so I really do believe that we have a huge responsibility to divert some of our supply to our neighbours and to countries that need it most, because ultimately we're not going to get on top of this pandemic if we continue to have virus circulating globally, and particularly if we have new variants. And those new variants are more likely to arise in settings with high viral loads where there's a lot of community transmission. So not only do we have an ethical and moral responsibility to support countries to get their vaccination coverage up, low and middle income countries, but actually from a global control of this pandemic point of view, we have to get more equitable distribution of the coverage. So
thanks, Margie. Joy, I might ask about the situation in India. India is a really important supplier of medicines and vaccines worldwide, but obviously we're facing significant shortage in supply of vaccines for COVID right now. What role does India play, or will they play, in producing vaccines for other low middle income countries that can't produce their own?
Yeah, I think this has been a kind of a testing time for us also. A kind of alignment of events that have made us relook at all our capabilities and what we can assure the rest of the world. And I think it is time to introspect for ourselves also. The producers in the country are largely private sector producers, and everybody has limitations in terms of finance and ability to ramp up. And as we've all by now become aware, vaccine production is a sensitive manufacturing line. It is not just mix up some chemicals and get a molecule at the end of it. So I think there is internal thinking and introspection as to how we can increase capacity and increase it in a sustainable manner. And I think more companies are now stepping forward to manufacture vaccine. I think people have to realize that unless everybody gets vaccinated and everybody gets protected in a global village or in a global scenario where there is so much travel and so much of supply chain dependencies across borders, I think unless there is vaccine being made easily available to countries, it is not going to happen. And so therefore it is everybody's responsibility to see that all countries have equitable access to vaccines. Yes, I completely agree with that stand.
Well, thank you, Joy and Margie and Dinesh. That's been a fascinating discussion to have, and it's great to get your different perspectives from different parts of the world as well. I think it's very clear that we are all in this together, and it's great to explore how India and Australia can continue to work together and be informed by each other's experiences. But thank you for your time today.
thanks a lot, Nathan.
Thank you. Thank you so much, Nathan.